everyone. You're welcome on today's program.
Recording in progress.
Your health matters. Thank you so much, everyone, for joining me today on the 48th edition of Your Health Matters program. On today's program, I have a lovely lady with me. I'm going to ask Lucy to introduce herself. So join me today to welcome our guest today, Lucy. Lucy. Sorry, I've got your name mixed up. So please, Lucy Humphreys. Please, you're welcome today on today's program.
Thank you, Lebake. So shall I just tell you a bit about myself?
Yes, please.
So I'm a cognitive behavioural therapist, and I currently work in Havering Talking Therapies. So we're a primary care mental health service, and we provide psychological therapies. I've been working in the team for about 5 years. I've been working in the NHS and mental health services for a lot longer than that. And I'm also the perinatal link for the team. So that just means that I maintain regular contact with specialist perinatal services in the borough of Havering in London.
Thank you, Lucy.
Within my own, just to explain a little bit more, within my own clinical work, I also work with women with postnatal depression as part of my caseload.
Thank you so much. I do apologize, Lucy. I was actually looking for the topic earlier on. So today on today's program, I've got Lucy Humphreys, and as I said earlier on, we are treating postnatal depression. So the reason why we're treating this topic was because a young lady actually sent an email to me. That was a few months ago, and she expressed what she was going through, how she got pregnant, and the problem she went through during pregnancy, and even when she's given birth now for a few months now, and she's still going through some difficulty, and it seems like the family, both the in-laws, the husband, the people around her, doesn't seem to understand. Even her, she didn't even know what she was going through. Like it was actually kind of a going through the depression when she explains, and everything she narrated, she was actually really, really affecting her mental state. And I begin to imagine, I said, it's okay for me to tell you, signpost you, and what about other people that are actually still out there that are going through the same trouble that you're going through. So, and that is the reason why I took my time to get Lucy to please come and share her knowledge and educate us on this program. And I do appreciate you, Lucy, once again, because I know how busy you are. So when we say postnatal depression, what do we mean, Lucy?
So it's simply a form of depression that affects, predominantly women, and it's in the first year after having a baby, or it can start during pregnancy. So we call this period of time the perinatal period, during pregnancy and in the first year after birth. And it's very common. So first of all, about 50% of mothers get what's called baby blues in the immediate, a few days after giving birth, about 3-4 days after giving birth. You're full of hormones, you get very emotional at that time, and you can feel depressed. But that often resolves after a few days. But then about 10 to 20% of women actually can develop postnatal depression if those problems don't resolve after a week or a couple of weeks. So postnatal depression is common. 10 to 20% of women can develop it. Approximately a third of women can develop postnatal depression in pregnancy, which continues after the birth. And also, it can also affect fathers or same-sex partners. And the National Childbirth Trust reports that 1 in 10 fathers can develop postnatal depression.
Wow.
But I think just for the sake of simplicity, I'll talk about women and mothers in this talk, if that's okay.
Yeah, sure.
Yeah.
So thank you, Lucy. So you did say perinatal. So when you said the trouble they go through during pregnancy. So how are we able to differentiate between normal symptoms of pregnancy, if you get what I mean? Then at what point will people know this is actually like a problem, like perinatal? So what are those signs and symptoms for them during perinatal, which is during pregnancy, and after? So at what point would they know they're actually going to depression?
Yeah. So first of all, I'll talk about the signs and symptoms of depression. So they're going to
Good.
be slightly different for every individual because
True.
we're all individuals, but there are some common signs and symptoms.
Okay.
So these may be feeling persistently sad or low in mood, feeling unable to enjoy things that you would normally enjoy, feeling very tired, experiencing disrupted sleep, maybe over and above what you'd expect if you're pregnant or with a young baby. Feeling very irritable, noticing you might notice changes in your eating or your appetite, so maybe no appetite or that you're overeating, comfort eating a lot. You might be feeling very anxious or on edge. You also are probably going to be experiencing a lot of negative thoughts and possibly about being a bad mother, not good enough mother, or not being able to bond with your baby, or you might be worrying an awful lot about harm coming to your baby. So, as you said, I think so. New mothers can experience all of these. So these are
Exactly.
not unusual things to
Exactly.
experience, and it doesn't necessarily mean they're depressed. But I think it crosses over into clinical depression when it lasts for longer, so it goes on for more than 2 weeks,
Okay.
and also if it's having a substantial impact on quality of life or functioning. So maybe it's affecting the woman's relationship with her partner and her baby, and maybe she's finding it more difficult to function day to day in her day to day life, and it persists for a long time.
Okay. Thank you. I think that actually make more sense, because I was going to say we all at a point, if you're a mother, will have gone through what you listed earlier. Yeah.
Absolutely.
so, but when it lasts more, and more than 2 weeks, and obviously it's actually, I think the point to hold on to is like when it's affecting the quality of life that you're actually living. Thank you so much. So you've actually said how long. So is this what you said during pregnancy or after? How long does postnatal depression last?
Well, that's a really difficult question to ask because it varies so much for every individual. Postnatal depression, it can be mild, moderate, or severe.
Okay,
And so for a mild case, it may just be a few weeks.
okay.
For severe, it may be a lot longer than that. But for most women, it's what I would like to emphasize, it's treatable and you can recover.
Okay, good. So it's treatable and people can recover. So I think what actually the points I want us to stress here is that it could be mild, it could be moderate, it could be severe. So it's not about being lazy, because to be honest, there is this culture from most of the black minority group that when you're pregnant and obviously you're experiencing moderate or severe depression, is being termed as being lazy, like you're being compared to other people, to say whatever you're going through, other people, this person, and people really don't like to be compared to one another, and it doesn't really help, you understand, in that situation. So when you say moderate and severe in your work of experience, how long, I know you said it varies, but how long are we looking at what range? Months, years, weeks? We're talking about moderate to severe now.
Mm. Yeah, I mean, it's a very difficult question. How long will it last? But so within the service that I work in, we work with people with mild to moderate problems, and we offer therapy for between 4 and 12 sessions normally. Sometimes it can be longer than that. So we see the majority of people recover within that time,
Wow.
between 4 and 12 sessions.
Between
That's
four.
normally weekly.
Okay.